My name is Rachel Young. So I am a hygienist at a periodontal practice. I first heard about LANAP when we went to an AAP meeting with my doctor. And I noticed that everyone had this LANAP lanyard on. I thought, man, what is that? It's this new laser that I had just heard about. And so I told my doctor, I said, let's go ahead and let's see what this is all about. So we were able to investigate it a little bit more. We had a rep come out, and I was just really interested in the fact that we have a laser now that is able to do things that we really haven't seen before. We can get in there and we can offer treatment to patients that is, no scalpels used, something that a lot of anxiety-prone patients deal with. So I thought, you know what, let's look into this. We did, and we were able to use it and utilize it in the office. The LANAP protocol is essential for hygienists to know. We see the patient so much more frequently, especially when they're coming back after the procedure's been completed. So we're really seeing, are the patients following, the home care instructions, that we can even delegate that or describe it to them so that they can easily do that at home and be able to follow the protocol that we give them. So it's essential we know what we're doing, especially the fact that you can't be going and probing any of these areas for a year. That's essential. The fact that we also need to be looking at these occlusion areas if patients are hitting things in a different way. So one thing that's important is that patients see us the most. They come into their hygienist, they're getting their teeth cleaned, they're either coming in for periodontal maintenance, and they trust their hygienist. They're seeing us more, they're trusting us, and when we're seeing these changes where instead of this pink, nice tissue, we're going down a road where people are losing bone and possibly going to be losing dentition, that's something that really affects them. And caring for these patients is so important that it's nice that we have a procedure that can go in there with minimal to no discomfort. It can give them results where they're keeping their teeth or their implants longer. Let's say after osseous, they have more root exposure. They're having blunting of tissue. They can't keep things as clean as they could. They're having sensitivity. These things affect their daily life all the time. Having sensitivity, having things that get stuck into their teeth, that's something that is very important to them. And to be able to offer them something different that's effective and that will be able to eliminate some of those issues for them, it changes the patients and their daily life. And to me, that's something that's most important. The number one thing I'm hearing when patients come back from having the LANAP procedure is that they didn't have any pain. They didn't know anything was done because everything feels great. And that's the number one thing that we want to hear. The last thing we want is someone to have any discomfort. But what they're also noticing is that their tissue isn't bleeding. The tissue looks nice pink. So that's a bonus. Hygienists are hungry for this. They want to be on the cusp of new information, of new technology, because they want to know more. They want to know what can they do for their patients. What kind of things can we provide that we haven't been able to before? And that's crucial.